Each day, Khoi Retia's salt repackaging business in Phnom Penh processes half a ton of fine salt. Part of the process involves this machine adding a tiny amount of iodine, and that means regular testing to ensure the concentration meets government standards. Iodine is critical for brain development in fetuses, babies and children, and it's essential for proper hormone functioning for everyone. Adding it is cheap, 2 cents per kilogram of salt. Yet, although Retia measures iodine levels, most repackagers, it seems, don't.
I cannot say if other producers are paying attention to this issue. From my side, I am concerned about iodine that has expired.
Almost all of the 80,000 tons of salt produced annually in Cambodia comes from SPCKK, a cooperative in the country's south. By law, SPCKK must iodize all of its salt output. But over the years, several of the iodizing machines it was given broke down, and it hasn't sourced spare parts. Now it has just 4 working machines, and that's not enough. The cooperative's technical chief told VOA its workers often spray iodine by hand, a method that is at best imprecise. The result, almost all of Cambodia's coarse salt contains no iodine, and most fine salt either lacks sufficient iodine or doesn't have any. All of it, however, is labelled as having the regulated amount. Cambodia's iodization program started in the late 1990s when nearly 1 in 5 primary school children had goiters, a condition in which the thyroid gland in the neck swells. With health problems associated with iodine deficiency largely solved by 2010, UNICEF stopped providing iodine. So the UN organisation was stunned when research in 2014 found more than 60% of mothers and children were iodine deficient. A report published last year described the findings as, quote, a serious public health problem, end quote, and warned that poorer families and rural families were the worst affected. Arnaud Layu, UNICEF's nutrition specialist, co-authored that report.
If you take the example of the coarse salt, which is a big salt, 90% of it was not iodized. And on the fine salt was approximately 40 to 50% was not iodized, when it was packaged as iodized salt.
The consequences are particularly serious for children.
Cambodia is investing a lot of money at the level of the Ministry of Education to improve education of their children. But having a lack of iodine in the brain, it decreases your IQ from 13 points.
The report makes clear that producers are to blame for ignoring a 2003 law on iodizing salt, as are the authorities for failing to enforce the law. The situation, though bad, should start to improve. UNICEF is working with this government subcommittee to devise a certification standard for all producers, although that could take 2 years. Then Kia Hak, who heads the subcommittee on salt iodization, explains how the new licensing system will affect salt producers.
They have to have a machine, iodine powder in stock, a brand name and salt with proper quality in order to get a license. It's a legal enforcement that the ministry has to conduct.
He would not comment on the failure of government agencies to enforce the existing law, but did confirm that no one has been prosecuted. The difficulty for concerned Cambodians is that every bag of salt carries a logo stating that it is iodized. To deal with that, the Ministry of Planning will now test every brand of salt and will place adverts in newspapers to tell people which they can trust. Robert Carmichael for VOA News, Phnom Penh.